Oh, it started very small. I just thought, oh, I'm getting acne. And I thought, well, isn't that funny? Only to see it continue to progress and get worse. My name is Loren. I have a condition called Rhinophyma.
Rhinophyma is an overgrowth of the oil glands in the skin of the nose. That visual change, that condition that you see when those oil glands have overgrown so much that they're truly distorting the whole nose just because the skin has gotten so thick.
Everywhere I go, I will be stared at, I will be looked at. I had a hard time finding a job. I limit where I go now because I just don't want to deal with it a lot of the times. Some people will just nicely look at it and move on. They don't think anything of it. Some will ask, which is fine. And then there's the group that are just, not the nicest people out there. He took one look, and the first thing they said to me was, oh, by the way, your insurance will not cover this. And I realized that it was going to be cutting into my retirement heavily. I mean, it was a very expensive procedure. I was kind of getting prepared for that. And then the event happened. She asked if she could ask me about my nose. And she says, you need to call Dr. Nayak. And I kind of almost blew her off, and I was like, oh yeah, okay, sure, I'll call him. She said, no, seriously, you need to call him. And I sent an email, and Aaron from his office emailed me back almost instantly and said, here's the pictures we need. Just take these for us so we can see the condition. And I was at work the next day. I got an email on my phone from Aaron saying, we got the pictures, the Dr. Nayak has seen them. Would it be okay if we do the surgery for free? See, I still can't get through this story easily. It's rough. It changed everything.
It's a really good way that we can give back to our local and national community, to people that really need it and don't have a lot of other places to turn. These big ones, I actually do these pro bono because it's an easy way for me to give back that uniformly makes the recipient happier than when they walked in my office.
I just assumed I was going to be 70 years old with this nose, and that was my life. How do you respond to someone who walks up to you and says, I can change that? We will find an answer. That was the first time anybody had said that to me first. We're going to fix this. I have no idea what to expect. I'm looking forward to being the unremarkable looking remarkable guy I used to be. And that's what I'm looking forward to. I'm looking forward to going to Walmart. Just walking through Walmart and no one bothering to look. Life is completely different, of course, the obvious. My days are normal. I see more into the future than I did before. And all of a sudden now I have to stop and go, oh, wait a minute, there's a world out there that I'm going to be a part of, that now I can go and step into, and I can continue to live my life. But to me, I keep looking at it and thinking, I have a future, which I don't think I thought about before.
Hour and a half, 2 hours to change his life for at least the next 10 or 20 years. If you're interested in seeing are you a candidate for it, both shape-wise and health-wise, email us. And then from there, on a telephone call, we will go through the kind of medical process and medical screening and make sure that it's safe to do.
I'll never be able to explain to Dr. Nayak how important he is. I will remember this always.